I am Dr. Sharon Belmar-George. I am the Chief Medical Officer of St. Lucia at the Ministry of Health, Wellness and Nutrition. The meeting has been very informative so far. The regional agencies have had the opportunity to present to us a lot of the data that they are seeing in relation to both infectious diseases and chronic non-communicable diseases. We have been able to review a lot of the programs that have been implemented, get updates on how they are working in the various countries. We were also able to look at where our gaps in healthcare as a region are so far. We also discussed some of the research that's coming out of the COFA's 70th research agenda. So about 5 or 6 of them were presented, and a lot of it is applicable to us within the region. We were also able to get presentations on the use of telemedicine, for example, in Guyana, as one of the ways that we could also implement within our country. In a forum like this, given a lot of the countries are noting the same issues, a lot of our data is very similar. It gives an opportunity for us to look at our lessons, our best practices, what works well in country, and also to share with the chief medical officers of other countries. It also gives us an opportunity to discuss our gaps and to make recommendations on how we could improve on health service delivery within country. So I think it's quite important, given a lot of our challenges are the same, although our resources may be different. It also allows us to collaborate with each other, to support each other as we push healthcare forward. I think for us as a region, there are 2 areas that we definitely need to strengthen. One of them is on chronic non-communicable diseases, especially the preventative measures. As a region, we in each island, we need to create more encouraging, more healthy environments within the country if we are to see improvements in chronic non-communicable diseases. We also need to look at our legislation and how it supports healthy environments, like our school feeding programs, our school and nutrition policies, our laws in relation to creating healthy environments, both at schools, within the workplace, and also within communities. The other area that we need to collaborate on more, strengthen, is our human resources for health. For most of us, there are certain key areas that we are seeing reductions, and it's impacting on our capacity to provide accessible health care, especially when it comes to nurses, specialist physicians. So human resources for health is another area that we need to provide a lot more attention to in a sustainable way. There are short-term, medium-term, and also long-term measures that we need to implement.